Hi, my name is Dr. Shahin Javaheri. I'm a plastic surgeon practicing in San Francisco, California. I'm double boarded by the American Board of Plastic Surgery and American Board of Otolaryngology. I wanted to discuss a topic of skull reshaping or skull implantation. These are used for people who are either have traumatic disorders or congenital abnormalities. For example, they may have a small forehead, they may have a flat back part of the skull or narrow part of the skull. All of these can be enhanced and improved using implants. These will require usually 3D technology using CAT scans. For example, this is a plastic model of somebody who had a very narrowing of the forehead. This is a plastic model. Again, an implant was created to shape this particular desire that we want, the shape that we wanted, and the implant was placed through a very small incision in the scalp and introduced to cover the front of the skull and a portion of the forehead, depending on a particular person's desires. Sometimes implants can include not just the forehead, but also the top of the eye area, the orbital area. This is usually either traumatic deformity, either from an accident or congenital, or perhaps from a birth injury. This is a plastic model of such a particular case where the implant was created to simulate and enhance the top of the orbital bone and the whole forehead that shapes something along this line. The particular person that I'm referring to had a very flattened portion of the forehead and the skull. This incision was fairly small from the top of the skull, from here to here, and an implant was introduced and secured using very small screws. Another example can be somebody who had a very flattened portion of the back of the forehead. This is an example of another patient who had an implant that created to resemble this, and that was placed again through a small incision in the top of the scalp, and it was placed to go in behind the scalp. This is a plastic model, but the actual implant can be molded to shape the deformity, and again using small screws that were secured. Sometimes the deficit can be very large, encompassing the entire part of the skull. This is an example of such a particular patient. This is an implant that was made to fix the entire top of the forehead, forehead and the skull. This particular deformity extended all the way to the front of the forehead and extended all the way to the back. So this particular patient had a deformity, a narrowed top of the head and the forehead, and this implant was to help that particular deficit. So how are these implants created? The implants are created using 3D technology in the facial areas or the body areas. Generally, we perform a CAT scan. The data from the CAT scan is sent to a company which I work with engineers. We create the implant to shape the implant is created to the exact shape that the patient either desires or the deficit that we are trying to fill. In the skull, around the eyes, the midface, the entire jawline. These are, or even the areas of the body, whether it's the pectoral areas, deltoid areas, calves, abdomen, back, calves, anywhere. Moving on, the different parts of the face. First, let's start with the temple areas. The temple areas that I'm referring to is a side just behind the orbital bone on the side of the forehead and the side of the skull. The temple is essentially the entire part of the side of the skull, but mostly we work with an area that is just behind the orbital area. We call those the temple hollows. It's hollowed because with fat atrophy or genetic factors, this part of the skull can actually, the fat is atrophied and creates a very hollow area. This can be rectified very easily using an implant. This implant is placed through a small incision, either right above the ear or in the hairline, and an implant is introduced to fill that area like this, and it essentially removes that hollowness. An implant is placed right over the muscle or under fascia. It's not under the skin, and gets rid of the hollowness very well. Moving on in below that area, let's work on the cheekbones, the very common area of the body, of the face at least, that is augmented is the cheekbones. This is one of the most common and well-recognized area of the face that is augmented using implants. Probably the most common ones are chin, followed by cheek. There are different areas too, but a cheek implant looks something along these lines. And again, all of these implants can be created to fit a particular look that a person wants, or a particular deficit that a person has, such as from trauma or surgical injury or anything else. But these implants can be created to either masculinize somebody's face, to create more angular looking, or feminize. But these implants are introduced through a small incision inside the mouth. What I mean by small is no more than this big, quarter of an inch or so. And this implant is introduced through that space, placed right over the bone of the cheek, and secured using, generally in my practice, one single screw. And implant creates a very nice shape in the cheekbones. No more fillers, no more going back every 3 months, 6 months, a year or so to get fillers, which add up to a lot of costs for the patient, as well as sometimes these fillers are not absorbable, they stick around. And one of the differences between a cheek implant and fillers of any kind is the fillers are generally soft tissue fillers. They're not hard tissue augmentation. And we are augmenting the hard tissue, so it's much more structural improvement using implants. Another area of the midface to get rid of the hollowness that people have around the eyes is what's called the tear trough implant. The tear trough implants, I usually place these, they can be placed either inside the mouth, but I usually place them under the eyelash, and is secured to go right over the bone in the lower part of the eye, and secured with two or three small screws, and is permanent. And one doesn't have to place fillers or fat grafting or anything like that ever again. Moving down, another common area is an angular implant for the jaw, or mandible angle implant. They come in different shapes and sizes, and also they come in different types. An implant can be placed to only augment laterally, or widening of the implant. They can be also placed to lengthen the mandible angle, the vertical mandibular widening, or sometimes a combination of all of them. This implant is placed through incision inside the mouth and is placed right over the angle of the mandible and secured using screws. At least I use 2 or 3 screws to secure them so they don't move. This is a common area that in my practice I implant. Another common area, a very common area that I implant, is the chin. A chin implant, they come in different shapes and sizes, and but generally they look something like this. Implant is placed through a small incision under the chin, usually about 1 centimeter or less than half an inch. Externally, they can also be done intraorally or inside the mouth too, although I prefer external approach. Implant is an augmentation of the chin for people who have protruded chin through either congenital factors or perhaps trauma, or just a desire to lengthen the chin. Very commonly, the chin implant is used with a rhinoplasty to reshape the nose. But the implant goes right over the jawline to to enhance the projection. There are implants that create vertical lengthening as well. Those are different specialized, a little bit more specialized implants. Anyway, these implants are secured either using screws or sutures or sometimes none of them. Another implant for the midface is the submalar or subcheek. Some people have hollowness in the area in below the cheek, and you want to enhance that. This is called a submalar implant. Is placed through the same incision as the cheek implant inside the mouth, and it goes under the cheekbone and is secured to the cheekbone again using screws.